Good guess.
Seizure.
Well, that's the life threat. So it's hypothalamus. So our cold receptors are in our periphery, our heat receptors are in our central nervous system, or they're in the brain. So when we're responding to a hot environment, it makes sense if you think about it. We have our thermoreceptors and they live right beside our osmoreceptors because changes in our level of heat or increases in heat usually go hand in hand with some degree of dehydration as well. So whatever happened to make the body, that was what happened. So we have response by our central thermal receptors in a hot environment. So central thermal receptors respond to an increase in body temperature. We know that we send our signals to which part of the hypothalamus? Which area? Something visual. Preoptic, right? So preoptic area of the hypothalamus. So send the signal to the preoptic area of the hypothalamus. And you think about it, we said what happens, or we start increasing or decreasing impulses in cold environment? Decreasing them, so what will happen in hot environment? Yeah, so we start seeing an increase in firing. So that preoptic area just starts firing faster. So we see increased rate of fire. So an increased rate of firing in the hypothalamus is going to lead to the effectors that are going to allow us to try and get rid of some heat if they're too hot. So in terms of the spinal cord or what my spinal cord can do to get rid of heat, what types of things are going to be stimulated? How am I going to get rid of heat? What are some of my mechanisms that I have available for me to get rid of heat? Sweating. So we know that's sympathetic nervous system, right? So we have activation of the sympathetic nervous system, or which receptors specifically?
Muscarinic.
Yeah. The activation of our muscarinic receptors.
Finally got it.
Which is going to lead to an increase in sweating. We said before we want to activate alpha-1 receptors in order to have vasoconstriction when we're cold. So we're going to have dilation. So we have deactivation of alpha-1 receptors in order to have vasodilation so we can get rid of more heat through radiation. So with the increase in sweating, that's loss of heat through what mechanism?
Evaporation.
Yep. So evaporation, so an increase in evaporation. And then we're seeing basically inhibition of alpha-1 receptors. Which is going to lead to vasodilation. And how I'm going to lose heat by what mechanism now?
Radiation.
Yeah, radiation. So it allows for an increased heat loss through radiation. So you start to see an increased heat loss through radiation. So we said that a few other things usually go hand in hand with high heat or heat loss. What's going to happen to this patient's fluid volume?
Decrease.
Yeah, it usually decreases. So we start to see the use of mechanisms to try and get more water or retain water. If you think about it, I need to retain water through my kidneys so that I can sweat it out through my pores if I want to get rid of heat. So what system would be activated in order to do that? What was not on your test?
Yeah, that one.
Yeah. So we have endocrine function. So we see activation of the renin-angiotensin-aldosterone system. Which leads to fluid retention. And think about it again, that's related to the dehydration that's going to develop, and because the body wants fluid in order to sweat. What else do you do when you get super hot?
Drink beer.
Yeah, or you drink, right? So we said the hypothalamus stimulates thirst, so we have the release of hormones that are going to lead to increased thirst. And what else are we going to do? If before we were increasing our BMR, what are we going to do in this case? Yeah, we'll decrease it. So we have inhibition of the thyroid. Which allows us to decrease our BMR and quit producing heat through metabolic. We also have some use of ADH and other hormones that are allowed for fluid retention, but these are the main things that are happening in order to regulate increase in body heat. So when these mechanisms fail, people become hyperthermic, or they start to have an increase in body temperature. And what are some ways that that can happen? What are some ways that someone can have increase in body temperature and become hyperthermic? Drugs. So we can have a metabolic cause. So we have metabolic or toxic hyperthermia. What else can happen?
Infection.
What's that?
Infection.
Yep, so infection produces it through metabolic means. So infection is similar to basically what's happening is your body is trying to fight it off, right? So we increase our set point and our temperature becomes higher, so that's a metabolic means. So it could be drugs, infection, tumor falls into this as well. So we have thyroid tumors, for example. They're going to increase BMR and increase metabolic heat production. So one of the major causes of hyperthermia is a metabolic or toxic cause. What else?
Exposure.
Yeah, so environmental. So the leading cause of hyperthermia is usually an environmental problem. People are outside in hot, humid environments. So environmental. Environmental hyperthermia. What else? Maybe the last one. That was the old people. What did you say?
So they can't drink.
It's part of it. So they lose adequate ability to thermoregulate. So their hypothalamus just becomes old and atrophied, and they lose thermoregulation. So the last one that happens is we see a decrease in thermoregulatory ability. Or the patient simply has just a decreased ability to actually regulate their heat loss. So environmental factors, a decrease in their ability to thermoregulate, or we see a metabolic or toxic hypothermia. So we see an increase in patient metabolism that might be causing the problem. So what are our stages of hyperthermia that we have? The first thing that happens when you start to get really hot, body becomes a little bit dehydrated.
Cramps.
Yeah, so initially we start with heat cramps. So heat cramps are really just related to a slight decrease in water volume and sodium. So we initially start to see, can I erase this? Am I good to erase it? Yeah. So initially we see a heat cramps developing, and that's just related to a loss of body water and loss of sodium. So you think about what's happening, it's the fact that we're sweating out so much that leads to these heat cramps. So first problem associated with hypothermic disorders is heat cramps. This is loss of H2O and loss of sodium. What comes next?
Heat exhaustion.
Yep, so we have heat exhaustion followed by heat stroke. So heat exhaustion is primarily characterized by dehydration. So what happens is the body starts losing excessive water through sweating and the patient becomes severely dehydrated. So we have heat exhaustion. And we have two types of heat exhaustion, or two types of dehydration that can happen in heat exhaustion. What are the two types of dehydration that we have? Characterized by dehydration.
Vascular and cellular.
So you have vascular and cellular. Yeah, they're kind of the same thing. So I'm talking about like a hypotonic dehydration, or where the patient actually has lots of fluid but they're still dehydrated, or we have just a regular water loss dehydration. then they look a little bit different. So we can get regular water loss dehydration, or that's also called isotonic dehydration. So isotonic dehydration. So what's happening if it's isotonic? If I'm losing salt and water, am I losing them at separate amounts, same amounts?
Same amount.
Yeah. So if I'm losing them at same amounts. So what ends up happening in a isotonic dehydration is I get rid of my body's sodium and water through similar amounts. So if we're looking at kind of dehydrated versus not dehydrated, in the regular body we have a sufficient amount of sodium, so that'll be our green molecules, and a regular amount of water. So what can happen in this case is, say I'm working outside in a hot environment. What do I have to get rid of first before I can get rid of any water?
Sodium.
Yeah, get rid of my sodium. So I start pushing sodium out into the environment and getting rid of my sodium, and water's going to follow it. So water follows, and instead of having an extensive amount in here, I have equal amounts of sodium and water, just less of it. So I'm still dehydrated because I don't have as much water as my body normally needs, but I have equal amounts of sodium and water still. Now, the problem is when people don't replenish their fluids with something that has an electrolyte in it as well. So the problem is when I say work out hard or work outside in a hot environment, I sweat, I'm losing sodium, I'm losing water. Now if I don't drink something that has an electrolyte in it, I'm just replacing water. So if I just drink copious amounts of water, that's where I can lead into what we call a hypotonic dehydration. Or that's when the patient has a lot of water, but they have a problem with their electrolytes. So hypotonic. Hypotonic dehydration, and what's happening is what the person is doing is they're replacing their fluid volume with just water. So we think about, we have the person who is, say, in a normal dehydration. Draw that on one side. So normal dehydration where they have a decreased amount of both sodium and water. What they end up doing is drinking large amounts of just water. People on MDMA do this all the time, right? You go to the rave, they do their MDMA, they sweat a lot, they carry around these big jugs of water and just chug water back. The problem is that now they only have a little tiny bit of sodium in their bloodstream, but they have a whole bunch of water. So the person drinks a lot of water.
Just put salt in the center.
It probably work. So what happens is, where's this water going to go? Because now my bloodstream is hypotonic, right? There's tons and tons of water in my bloodstream.
Into the cells.
Right. So it starts shifting into the cells. So this is where we start seeing our water shifting into the cells, and we start building up. We're getting swollen cells, and I can't sweat, and that's part of the problem with it. So people get so hyperthermic, or they get so hot, but they've lost a number of electrolytes, and they've only replaced it with water, so my fluid can't shift out into my sweat glands. I need sodium in order to sweat. So it just goes into the cells, and they get severely dehydrated, they get all of this interstitial edema, and they actually stop sweating. So you have that patient who's obviously hyperthermic, or who has increased body temperature, but you don't see any sweating. It's probably because they haven't replaced their water and their electrolyte volumes appropriately. So they may just be shifting that fluid into their intercellular or their interstitial space, and they become dehydrated that way. Does that make sense, the difference between the two? So one is just the inadequate replacement of electrolytes. So that's why things like Gatorade or basically recovery sports drinks that have electrolytes in them are so important. Questions? There's a difference between the two. So in terms of signs and symptoms that we see with heat exhaustion, what's that going to look like, or what's going to happen to these people? Yep. So we see tachycardia. Now usually these patients aren't particularly hypotensive, so they can usually compensate fairly well. So they're still dehydrated, but we see that maybe borderline low or normotensive. Once we start moving towards hypotension, that's when patients start developing heat stroke. So once we start seeing severe cardiovascular changes, that's a problem. So tachycardia, we could see a normal or slightly low blood pressure. What else? Cramps, like we talked about, will carry over.
Maybe some confusion or like altered LOA.
Yeah, so confusion and alteration LOA. If that starts to become severe, then we've progressed to heat stroke. And that's the main characteristic difference between heat stroke is hypovolemia and severely altered LOA. So usually confusion in this stage. We said they might be sweating or they might not be, right? We could see excessive sweating or no sweating. Anything else? What's going to happen to the cells of the brain? Yeah, so patient might start complaining of headache, right? So this is where we may see headache develop. And those are typical. It's increased respirate as well. So again, they're becoming acidotic and hyperthermic. So we see an increase in their respiratory rate. And then obviously an increase in body temperature. Does that make sense? So where do we progress from here after heat exhaustion? Yeah, the patient ends up in heat stroke. And we have two different types of heat stroke. What are the two different types of heat stroke?
Classic and exertional.
Yeah, classical and exertional. Basically, exertional is just as it sounds, right? So usually it's related to environmental factors. So someone working out or doing extensive exercise in a hot environment is going to lead to our exertional heat stroke. Classical is more one of these two things. So what's happening is the patient isn't actually doing anything. Usually it's that old person who's sedentary, who takes a whole bunch of their ASA or is taking their medications improperly or has a poorly developed hypothalamus and sits in their hot apartment all day and can end up getting hyperthermic. Infections can lead to a classical heat stroke. Anything that's basically not exertional or environmentally related is what we're looking at in terms of a classical heat stroke. So, can I erase this?
Your computer turned off. I think it's still recording on the satellite.
So, basically what's happening is they're going to have all the problems that are associated with a heat exhaustion, or all the things that are occurring in heat exhaustion, but we also start seeing the problems that occur when we have increased temperature in the body. So when we're looking at this patient, we know that the first thing that's going to happen is we have an increase in body temperature. Increase in body temperature, which is going to allow for us to start compensating. We see an increase in compensatory mechanisms. And what are the two core compensatory mechanisms that we see? We see in someone who's got hyperthermia. Yeah, sweating is the big one, right? So the first thing we see is excessive sweating. So we have increased compensation, which leads to sweating, which we know if we don't replenish anything, we can lead to a isotonic dehydration. So no fluid replenishment. Leads to an isotonic dehydration. Or what can they do improperly?
Control their
Too much water.
Yeah, too much water. So we see an increase in water intake. And what type of dehydration do we see developing? Yeah, we see hypotonic dehydration. And as a result, this is where we're getting those signs and symptoms of heat exhaustion. So this is kind of the core of heat exhaustion. So heat cramps with the addition of a dehydration. So this is where we see heat exhaustion. Well, so how else do we say we're going to try and compensate for an increase in body temperature? What's that?
Some metabolism.
Yeah, we're going to decrease BMR. And what else are we going to do to our blood vessels?
Dilate.
Yeah, we dilate them. So we're going to try to decrease BMR. We're going to try to dilate vessels. See dilation of vessels. We know we have sweating as well. And what happens in heat stroke is we have failure of those compensatory mechanisms. So despite the attempts of our body to try and compensate adequately, we have failure of compensatory mechanisms, and the patient starts to have a drastic increase in heat production, and they start to have dehydration. So we start to see failure of compensatory mechanisms. Failure of compensatory mechanisms, which ultimately leads to a drastic increase in body temperature. So we start to see body temperature increasing. And what's the problem with that? What happens to our proteins when we have an increase in body temperature? Yeah, we start to see denaturation of proteins. So part of the problem with getting so hot or allowing the body to get so hot is proteins need to live within a certain temperature range. So as soon as we start progressing past 39 and 40 degrees Celsius, we start to see protein denaturation happening, and the patient will start to enter into heat stroke. So an increase in body temperature, one of the really bad things that happens associated with that is we have protein denaturation. And we start to see some pretty severe side effects in the brain. Protein denaturation, which leads to impaired CNS function. What do you think the life threat here is? What's going to happen with this patient? Yep, we can see acidosis, change in respiratory rate. What's going to happen before they die?
Seizure.
Yeah, so we get seizure, coma, death. So this is one of the things that pretty much leads right into that. So as soon as we start to have protein denaturation in the brain, the patient's at high risk of seizure, and then they can go towards seizure, coma, death. The problem with the increase in body temperature as well is it starts to stimulate an inflammatory response. So we have an increase in inflammation. And we said inflammation does what to our vessels? Yeah, dilates them and makes them more permeable, right? So what we see happening with this inflammation is our peripheral vessels get even more dilated, because we're already dilating them, right, to try and get rid of all of this temperature. Well, the problem is that as we have inflammation, we dilate these vessels, we make them more permeable, and we can lose, again, fluid interstitially, and the patient's going to enter what type of state? Hypovolemic, or shock state, right? So increased inflammation, we see fluid shifting, and hypovolemia. The last thing that we see happening with someone who's developing increase in body temperature is we actually have damage to the vascular endothelium. So as the temperature gets super high, we actually just damage the lining of the vessels. So the vessels become destroyed, and we see even more vasodilation. So this patient is at risk of developing denaturation of proteins and problems with autoregulatory function, and they're going to go into an end-stage shock. So they're at high risk of developing distributive shock state. Or they have enough blood in their system, but they just become so vasodilated that they can't supply the brain, the kidneys, and they get organ failure as a result. So we start to see vascular damage. So what's happening when someone enters a heat stroke is we get both of these things. The heat stroke is characterized by both the dehydration and the high body temperature that's doing this protein denaturation and causing the increase in vasodilation. So this is stroke. So you'll probably notice, what slides did we post for these? Are they the same as the other ones, like the gray background? So there'll be a chart in there on classical versus exertional heat stroke, and you'll see questions coming up on those. So let's say, again, you'll have a patient, it'll either be an old dude in his house who's taken an overdose, or it'll be a young dude who's ran a marathon or done a triathlon, and he'll just ask, is this an example of exertional, or what is the patient in? Is it heat exhaustion, heat cramps, heat stroke? It'll talk about fluid shifting, so it might say something about drinking excessive black water, and if there's fluid shifting in the brain, and then ask you this classical exertional type of thing. Make sense? Everything make that sense? What's the life threat we said that? Seizure. So you see that as well. So, in terms of managing this patient, what are the two things that are probably most important? Fluid, and before that?
Passive cooling.
Yeah, just get them out of there, right? Get them into a cool environment, and then give them as much fluid as you can. So again, if you're thinking about the seizure patient, right? This is one of those things we talked about, where is midazolam really going to work for this patient? Probably a more appropriate response to this guy is to get him in that cool environment, get that line started, start pumping him full of fluids, and then consider your midazolam as a kind of tertiary priority, because we know what's causing the problem. It's the vasodilation, the heat environment, the really hot environment, and the fact that he's lost so much fluid. And the nice thing about us is we carry fluid that gives him both the things he needs, sodium and water. So keep that in mind for when you get to your PADI class next week. So these are the types of